With September being Pain Awareness Month, it's the right time to discuss the different treatment options for headaches and migraines. Now, Lori Jennings, Deputy Director of the Good Housekeeping Institute, and Dr. Paul Matthew, Assistant Professor of Neurology at Harvard Medical School and Founder of the Visiting Scholars Program at the John R. Graham Headache Center, join me with more information. Thank you both so much for being here.
Happy to be here.
So, Lori, starting with you, why is Good Housekeeping partnering with Allergan on this?
Well, Good Housekeeping has a huge audience across the country, and we're mostly women. And of course, many of these chronic conditions, these invisible conditions, affect women more than men. Often 3 times as many women suffer from chronic migraine, for example, than men. So we really wanted to partner with Allergan to help raise awareness and get the message out that if you can seek an accurate diagnosis, there are treatment options available, you can have a much more satisfying life.
Right. It's definitely not satisfying when you have a giant headache. And so, doctor, let's define for people who either may not have had it before or do have it, let's define chronic migraine.
So first of all, migraine is a genetic disease, just like high blood pressure and diabetes. So it's really important to make that diagnosis in order to receive the appropriate treatment. It's also important because migraine is extremely common. About 1 in 5 women have migraines and about 1 in 20 men have migraines. And chronic migraine, by definition, is when you have a headache for more than 15 days per month. And again, this is not just a disabling headache, but it's also light sensitivity, sound sensitivity, nausea, vomiting, all these things that really prevent people from picking up their kids from school, doing household activities, and even going to work. So it's really disabling. The diagnosis is best made by a neurologist or a headache specialist who is someone who is either fellowship trained or board certified in headache medicine. And if you do carry the diagnosis, there are effective abortive and preventative treatments for migraine.
And so if someone at home is listening to this and saying, you know what, I have the nausea, I have the sensitivity to light, what should their next step be? So
the next step should be to see a physician and get the diagnosis right. And once you have that diagnosis, then the appropriate abortive and preventative medications can be prescribed. So an abortive medication is something you take when you have a headache to treat that single headache, while preventative treatment is something you do on a routine basis to prevent the headaches from even coming on. Some of the oral treatments, which are older, involve propranolol and topiramate. Those can be effective, but also have side effects like lightheadedness, dizziness, tingling, and cognitive issues. Another treatment option is Botox injections, which was the first FDA-approved treatment for chronic migraine back in 2010. It involves injections once every 12 weeks, so a total of 4 times a year. And although that may sound like a lot, many patients are happy to receive those injections if it means better control of their frequent disabling headaches. I often tell my patients, better for you to control your migraines than for your migraines to control you.
Right, definitely true. And so, Lori, if you had to leave our viewers with anything, any more information you want to share with them, what would that be?
Well, one quick tip, which is a great thing when you're going to see that doctor, is to keep a journal of your headache days, what you eat, how you slept, stress levels, those kinds of things, so your doctor can really get that diagnosis right. And then if you are interested in more information, you can visit BotoxChronicMigraine.com. There's a great tool there that will help you find a headache specialist in your area, as well as tons of other information.
You can also check out the American Migraine Foundation website.
Right. Partner with your doctor. They're your best friend. They're the experts in all of this. There's no reason not to bring these things up to them, because more often than not, they're going to be able to fix you and make you feel better. So I want to thank you both so much for joining me today.
Thank you.
Thank you for having us.
Got it.
All right. We'll be right back.